Question 1. When assisting a patient with mobility, which of the following is the most important consideration for the home health aide to ensure patient safety during transfers? A. Ensure the patient is lifted off the bed as quickly as possible. B. Use proper body mechanics to prevent injury to both the caregiver and the patient. C. Avoid using assistive devices, as they are not necessary for short-distance transfers. D. Focus solely on the patient's comfort during the transfer, regardless of safety precautions. Answer B. Use proper body mechanics to prevent injury to both the caregiver and the patient. Explanation. When assisting with patient transfers, proper body mechanics are crucial for both the caregiver's and patient's safety. The caregiver should maintain a stable base of support, use their legs for strength, and avoid twisting motions to prevent back injuries. It is essential to use assistive devices, such as gait belts or transfer boards, when necessary to ensure safety during transfers. Improper techniques, such as rushing transfers or lifting without support, could lead to injuries to both the caregiver and the patient. As a general rule, care must be taken to avoid any actions that compromise the safety of either party. This includes maintaining the patient's dignity, but always prioritizing safety first. Question 2. Mr. Thomas is a 72-year-old patient with early-stage Alzheimer's disease. He is becoming increasingly frustrated when he cannot remember simple tasks, such as putting on his socks. As his caregiver, which of the following approaches should you take to help manage his frustration? A. Encourage him to complete the task on his own, as he needs to maintain his independence. B. Ignore his frustration and continue to complete the task for him, without offering assistance. C. Use calm, simple instructions and offer encouragement to complete the task slowly. D. Dismiss his frustration as a normal part of aging and avoid providing emotional support. Answer C. Use calm, simple instructions and offer encouragement to complete the task slowly. Explanation. For individuals with Alzheimer's disease, patience and clear communication are essential. Frustration arises from their cognitive impairment, which may make even simple tasks seem overwhelming. The best approach is to use simple, calm instructions and allow the person to perform the task at their own pace, offering assistance when needed. Encouragement should be provided to help boost confidence. Independence should be supported as much as possible, but caregivers must also offer emotional support and help when necessary. Encouraging independence without offering support when needed may result in further distress, and ignoring frustration can harm the patient's emotional well-being. Question 3. A home health aide is helping to bathe a patient who has severe mobility issues and is at high risk for developing pressure ulcers. Which of the following actions is most appropriate to help prevent the development of pressure ulcers during the bath? A. Bath the patient as quickly as possible to reduce the time spent in one position. B. Make sure the patient is positioned correctly, using pillows or foam wedges to alleviate pressure on bony prominences. C. Use hot water during the bath to improve circulation and prevent skin breakdown. D. Leave the patient lying flat without any repositioning during the bath to avoid further discomfort. Answer B. Make sure the patient is positioned correctly, using pillows or foam wedges to alleviate pressure on bony prominences. Explanation. When caring for patients at high risk for pressure ulcers, it is essential to ensure that pressure is relieved from bony prominences, such as the heels, elbows, and sacrum. Proper positioning using supportive devices like pillows, foam wedges, or specialized cushions can help reduce the risk of developing pressure ulcers. Speeding up the bath, as in option A, or using hot water, option C, does not address the critical issue of pressure relief. Inappropriate positioning, as in option D, could exacerbate the risk of pressure ulcers, leading to further skin breakdown. Therefore, positioning the patient correctly and ensuring adequate support is a key preventative measure in such cases. Question 4. Mrs. Anderson, an 80-year-old woman with chronic arthritis, requires assistance with dressing each morning. She often experiences pain and stiffness, which makes it difficult for her to dress herself. When helping her, what should the home health aide do to ensure her comfort and independence while also preventing injury? A. Rush through the dressing process to minimize the time spent on the task. B. Assist her with clothing, but allow her to participate as much as possible, using adaptive devices if needed. C. Do the task entirely for her to avoid causing pain or stress. D. Encourage her to dress without assistance, even if it causes some discomfort. Answer B. Assist her with clothing, but allow her to participate as much as possible, using adaptive devices if needed. Explanation. For patients with chronic conditions like arthritis, it's crucial to maintain as much independence as possible while ensuring comfort and reducing pain. The caregiver should provide assistance with dressing, but also allow the patient to participate in the process as much as possible. Using adaptive devices such as button hooks or dressing aids can help the patient manage independently without causing undue stress or injury. Rushing the process, option A, could cause discomfort or harm, while doing the task completely for her, option C, may decrease her sense of independence. Encouraging complete independence, option D, may result in unnecessary pain or frustration. Question 5. A patient with advanced dementia has become agitated and refuses to take a bath, expressing that they are fearful of the water. How should the caregiver respond to manage the patient's agitation and ensure personal hygiene is maintained? A. Ignore the patient's fear and proceed with the bath to maintain hygiene. B. Try to reason with the patient and demand compliance for the bath to avoid infection. C. Use calming techniques, such as speaking softly and providing reassurance, and offer a bath at a later time. D. Threaten to withhold privileges unless the bath is taken, to encourage compliance. Answer C. Use calming techniques, such as speaking softly and providing reassurance, and offer a bath at a later time. Explanation. For patients with dementia, fear and agitation are common, especially in unfamiliar or overwhelming situations like bathing. It is essential to approach the patient with patience, using soft, reassuring language and avoiding forceful tactics. Offering the bath at a later time, when the patient may be calmer, is often more effective than trying to force compliance. Reasoning with the patient or threatening them, options B and D, are unlikely to be productive and may increase the agitation. In some cases, providing a bed bath or using alternative hygiene methods may be necessary to ensure the patient's dignity while maintaining proper hygiene. Question 6. While assisting a patient with a feeding tube, the caregiver notices that the insertion site appears red and inflamed. The patient is also complaining of pain around the area. What should the caregiver do in this situation? A. Continue to feed the patient as planned and document the observation. B. Try to clean and apply ointment to the area without consulting a healthcare professional. C. Immediately report the observation to the supervisor or healthcare provider for further evaluation and potential treatment. D. Discontinue feeding through the tube and report to the patient's family instead of a healthcare provider. Answer C. Immediately report the observation to the supervisor or healthcare provider for further evaluation and potential treatment. Explanation. In the case of a feeding tube site showing signs of redness, inflammation, and pain, it is crucial for the caregiver to report the situation to a supervisor or healthcare provider right away. These symptoms may indicate an infection or complication that requires medical intervention. Ignoring the signs, option A, or attempting to treat the site without professional guidance, option B, can result in worsening of the condition. Discontinuing feeding, option D, without proper consultation may compromise the patient's nutritional intake and health. Ensuring proper care and communicating with the healthcare team is the most appropriate course of action. Question 7. Mr. Johnson, a 65-year-old patient with Parkinson's disease, requires assistance with daily living tasks such as dressing, eating, and personal hygiene. Which of the following strategies would be the most effective for promoting his independence while also ensuring his safety? I provide complete assistance with all tasks to avoid any potential accidents. B. Encourage him to perform as many tasks as he can on his own, offering assistance only when necessary. C. Withhold assistance entirely to encourage him to regain his full independence. D. Limit assistance and allow him to perform tasks regardless of the risk of injury. Answer B. Encourage him to perform as many tasks as he can on his own, offering assistance only when necessary. Explanation. For patients with Parkinson's disease, maintaining independence is essential for emotional well-being and preserving dignity. The best approach is to encourage the patient to do as much as they can independently, providing assistance only when necessary. This can be done by using adaptive equipment and modifying the environment to make tasks easier. Offering complete assistance, option A, or withholding support entirely, option C, could lead to unnecessary dependence or frustration. Allowing the patient to perform tasks, even if it involves some risk, without offering assistance, option D, is not safe and could lead to falls or injury. Question 8. A caregiver is assisting a patient who is on a special diet due to diabetes. The patient requests a snack, but the caregiver notices that the requested food is high in sugar and could cause a spike in blood sugar levels. What should the caregiver do in this situation? A. Give the patient the snack to avoid confrontation and keep the patient satisfied. B. Deny the patient the snack and explain that it is not allowed on their diet. C. Offer a substitute snack that fits within the patient's dietary restrictions while explaining the reasoning. D. Allow the patient to have the snack but monitor their blood sugar closely afterward. Answer C. Offer a substitute snack that fits within the patient's dietary restrictions while explaining the reasoning. Explanation. For patients with diabetes, it is crucial to adhere to dietary restrictions to manage blood sugar levels. The caregiver should never ignore the patient's dietary needs, but rather offer a healthy alternative that aligns with the prescribed diet. Offering a substitute and explaining the reasoning, option C, ensures the patient's health and maintains trust. Giving the patient an unrestricted snack, option A, or simply denying the request without explanation, option B, could create frustration or noncompliance. Monitoring blood sugar after allowing the snack, option D, could be helpful but does not address the immediate dietary concern. Question 9. When caring for a patient with a catheter, the caregiver notices that the catheter tube has become kinked, which may prevent proper drainage. What is the most appropriate course of action? A. Leave the tube as it is and inform the patient to try and reposition themselves to relieve the kink. B. Immediately straighten the tube to ensure proper drainage and inform the supervisor or healthcare provider of the issue. C. Ignore the kink, as it may resolve on its own without intervention. D. Remove the catheter and attempt to clean it, disregarding the healthcare provider's instructions. Answer B. Immediately straighten the tube to ensure proper drainage and inform the supervisor or healthcare provider of the issue. Explanation. In cases where a catheter is kinked, Immediate action is required to relieve the kink and allow for proper drainage. Straightening the tube will help avoid complications such as urinary retention or infection. It is also essential to report the situation to a supervisor or healthcare provider, as further assessment may be necessary. Ignoring the kink, option C, or attempting to clean the catheter without proper training, option D, could lead to serious complications. Caregivers should always adhere to protocols and communicate with healthcare professionals to ensure safe and proper catheter care. Question 10. A home health aide is working with a 45-year-old patient who has recently undergone hip replacement surgery. The patient has limited mobility and is at risk for developing a deep vein thrombosis, DVT. Which of the following measures should the caregiver implement to help prevent DVT? A. Keep the patient in a completely immobile position to avoid strain on the surgical site. B. Encourage the patient to perform leg exercises as directed by the physician to promote circulation. C. Use a heating pad on the affected leg to relieve pain and encourage blood flow. D. Encourage the patient to remain in bed without movement to avoid pain or complications. Answer B. Encourage the patient to perform leg exercises as directed by the physician to promote circulation. Explanation. To prevent DVT after surgery, promoting circulation is critical. The caregiver should encourage the patient to perform prescribed leg exercises to help with blood flow and reduce the risk of clot formation. Keeping the patient immobile, option A, or promoting complete bed rest, option D, can increase the risk of DVT. The use of a heating pad, option C, may not be appropriate without specific guidance from a healthcare provider and can lead to complications. It's essential to follow the physician's instructions and encourage movement as appropriate for the patient's condition. Question 11. Mrs. Taylor, a 72-year-old woman, is recovering from a stroke and is experiencing partial paralysis on her left side. She is also showing signs of depression, including withdrawing from social activities and expressing feelings of hopelessness. What should the caregiver prioritize to best support her recovery and mental well-being? A. Provide complete assistance with daily tasks to avoid any potential frustration. B. Encourage independence in daily activities, offering support only when needed, and refer to a mental health professional for further evaluation. C. Discourage social interactions and limit visitors to avoid overwhelming her. D. Focus only on her physical recovery, as her emotional well-being is secondary to her rehabilitation. Answer B. Encourage independence in daily activities, offering support only when needed, and refer to a mental health professional for further evaluation. Explanation. For patients recovering from a stroke, it's important to focus on both physical and emotional recovery. Encouraging independence helps preserve dignity and promotes recovery, while offering assistance when needed ensures safety. Referring to a mental health professional is crucial for managing depression and improving the patient's quality of life. Providing complete assistance, option A, could decrease her independence, while limiting social interactions, option C, may exacerbate feelings of isolation. Focusing solely on physical recovery, option D, may neglect the importance of mental health. Question 12. Mr. Peterson, a 60-year-old man with diabetes and hypertension, is being discharged from the hospital after a recent heart attack. The healthcare team has recommended a low-sodium, low-fat diet to help manage his condition. The caregiver is responsible for preparing meals. What is the most appropriate approach to ensure Mr. Peterson's dietary needs are met? A. Prepare meals that are high in sodium to help him maintain his energy levels. B. Follow the dietary guidelines provided by the healthcare team, focusing on low sodium and low-fat meals, and monitor his weight and blood pressure. C. Offer him whatever foods he likes, as long as he enjoys the meals. D. Limit the variety of foods to make meal planning easier, even if they don't align with the prescribed diet. Answer B. Follow the dietary guidelines provided by the healthcare team, focusing on low sodium and low fat meals, and monitor his weight and blood pressure. Explanation: Mr. Peterson's health conditions require careful dietary management, particularly to reduce the risks associated with heart disease, diabetes, and hypertension. Following the healthcare team's dietary guidelines ensures the patient's nutritional needs are met while adhering to prescribed restrictions. Offering foods outside of the recommended guidelines, options A, C, and D, could exacerbate his health conditions. Additionally, monitoring weight and blood pressure is important for tracking the effectiveness of the dietary changes and adjusting the plan as necessary. Question 13. Mrs. Green, a 78-year-old woman, is receiving care for osteoporosis and is at risk for fractures. The caregiver needs to assist her with mobility around her home. What safety precautions should the caregiver take to minimize the risk of falls and fractures? A. Allow Mrs. Green to move independently, without assistance, to encourage strength and independence. B. Remove any obstacles or hazards from her home, ensure proper lighting, and assist with walking when necessary, using walking aids if recommended. C. Encourage Mrs. Green to stay in bed as much as possible to avoid falls. D. Only assist with mobility when she asks for help, as it is important to respect her autonomy. Answer B. Remove any obstacles or hazards from her home, ensure proper lighting, and assist with walking when necessary, using walking aids if recommended. Explanation: For patients with osteoporosis, preventing falls is critical due to the high risk of fractures. The caregiver should ensure the home is free from obstacles, well-lit, and safe for mobility. Assisting with walking when necessary and using recommended walking aids can reduce the risk of falls and injuries. Allowing the patient to move independently, option A, or staying in bed too much, option C, can increase the risk of falls and harm. The caregiver should be proactive in offering support rather than waiting for the patient to ask, option D, as falls can occur suddenly. Question 14. Mr. Watson, a 50-year-old man with severe asthma, has been instructed to use an inhaler during asthma attacks. During a visit, the caregiver notices that Mr. Watson is struggling to breathe and has difficulty using his inhaler correctly. What should the caregiver do in this situation? A. Ignore the issue and wait for the patient to figure out how to use the inhaler on his own. B. Assist the patient in properly using the inhaler, ensuring the correct technique, and monitor his breathing closely. C. Call emergency services immediately, even if the patient's condition seems manageable. D. Offer alternative remedies, such as a warm beverage, and wait for the symptoms to subside. Answer B. Assist the patient in properly using the inhaler, ensuring the correct technique, and monitor his breathing closely. Explanation: If the patient is struggling to breathe, immediate assistance is necessary. The caregiver should ensure the patient is using the inhaler correctly, as improper technique can lead to insufficient relief. Monitoring the patient's breathing and providing help in following prescribed asthma management techniques is vital. Calling emergency services, option C, may be necessary if the condition worsens, but immediate action with the inhaler is often the first step. Alternative remedies, option D, are not appropriate for acute asthma attacks. Question 15. A 55-year-old patient, Mr. Allen, is being treated for chronic obstructive pulmonary disease, COPD. He frequently experiences shortness of breath and has difficulty walking long distances. What are the most effective strategies for improving Mr. Allen's breathing and quality of life? A. Encourage complete bed rest to minimize exertion. B. teach deep breathing exercises and recommend regular, light physical activity, such as walking short distances, to improve lung function. C. Suggest stopping all physical activity to avoid exacerbating his condition. D. Focus on medications alone and avoid exercise, as physical activity might worsen the symptoms. Answer B. Teach deep breathing exercises and recommend regular, light physical activity, such as walking short distances, to improve lung function. Explanation: for patients with COPD, managing shortness of breath and improving lung function is key to enhancing quality of life. Deep breathing exercises can help the patient manage their breath more effectively, while light physical activity like walking can strengthen the lungs and improve overall fitness. Complete bed rest option A, or avoiding all physical activity option C, is detrimental to the patient's well-being, as it can worsen symptoms and reduce stamina. Medication option D is important, but it should be complemented by physical activity to optimize treatment outcomes. Question 16. A patient with a history of urinary incontinence requires assistance with personal care. The caregiver notices that the patient's skin is becoming irritated in the area of the perineum due to frequent wetness. What should the caregiver do to prevent further skin irritation and ensure comfort? A. Use harsh soap and water to clean the area thoroughly after each incontinence episode. B. Apply a thick layer of petroleum jelly to the skin to prevent moisture from coming into contact with it. C. Change incontinence products frequently. Clean the area gently with a mild soap and apply a barrier cream to protect the skin. D. Leave the skin exposed to air as much as possible to allow it to dry out. Answer C. Change incontinence products frequently. Clean the area gently with a mild soap and apply a barrier cream to protect the skin. Explanation: to prevent skin irritation caused by urinary incontinence, it's important to maintain good hygiene and protect the skin from moisture. The caregiver should change incontinence products regularly and clean the area gently with a mild soap. Applying a barrier cream can protect the skin from further irritation. Harsh soap option A could damage the skin, while petroleum jelly option B may not be appropriate for all patients. Leaving the skin exposed to air option D can help in some cases but should not replace the regular hygiene and protection regimen. Question 17. A patient with a history of falls is at high risk for further accidents, especially when using the stairs in their home. What steps should the caregiver take to reduce the risk of a fall when the patient needs to use the stairs? A. Allow the patient to use the stairs as they normally would, only intervening if they ask for help. B. Install handrails on both sides of the stairs, ensure proper lighting, and assist the patient while they use the stairs. C. Discourage the patient from using the stairs entirely to prevent any risk of falling. D. Encourage the patient to use the stairs alone and only monitor from a distance. Answer B. Install handrails on both sides of the stairs, ensure proper lighting, and assist the patient while they use the stairs. Explanation: to minimize the risk of falls, safety precautions should be put in place. Installing handrails on both sides of the stairs and ensuring proper lighting are essential steps in creating a safer environment. The caregiver should assist the patient when using the stairs, offering physical support and supervision. Completely discouraging stair use option C may not always be feasible, and allowing the patient to use the stairs unsupervised options and D increases the risk of falls. Question 18. A 70-year-old male patient with hypertension and kidney disease is on a fluid restriction due to his medical condition. The caregiver is responsible for ensuring he stays hydrated, but also adheres to his restrictions. What should the caregiver do to ensure the patient maintains proper hydration without exceeding the prescribed limit? Encourage the patient to drink large amounts of water at once to prevent dehydration. B. Offer small, frequent sips of water throughout the day to help the patient stay hydrated without exceeding the fluid limit. C. Give the patient any fluids they request, as long as they are not sugary or caffeinated. D. Limit fluid intake entirely, and only offer water when the patient feels extremely thirsty. Answer B. Offer small, frequent sips of water throughout the day to help the patient stay hydrated without exceeding the fluid limit. Explanation: for patients on fluid restrictions, it's important to balance hydration with their medical needs. Offering small, frequent sips of water throughout the day ensures the patient stays hydrated without exceeding their fluid intake limit. Encouraging large amounts of water option can lead to fluid overload, while limiting fluids entirely option D can cause dehydration. Allowing unlimited fluids option C can also lead to health complications if the patient is on a strict fluid restriction. Question 19. Mr. Lewis, a 45-year-old man, is recovering from a leg amputation. He is struggling emotionally with the loss and often expresses feelings of anger and sadness. What should the caregiver do to support his emotional well-being during his recovery? Ignore his emotional struggles, focusing solely on his physical recovery. B. Encourage him to express his feelings and consider involving a mental health professional to help him adjust. C. Tell him to move on and focus on the positive aspects of his recovery to lift his spirits. D. Discourage him from talking about his emotions, as it may be too difficult for him to process. Answer B. Encourage him to express his feelings and consider involving a mental health professional to help him adjust. Explanation: emotional support is a critical component of recovery after a major event like amputation. Encouraging the patient to express their feelings helps validate their experience and supports emotional healing. Involving a mental health professional can provide additional resources and strategies to cope with the loss. Ignoring emotional struggles, option A, or telling the patient to move on, option C, invalidates their feelings, and discouraging emotional expression, option D, could lead to further distress. Question 20. A patient with Alzheimer's disease becomes easily agitated in the evening, a phenomenon known as sundowning. What can the caregiver do to manage the patient's agitation and improve their comfort during this time? Ignore the agitation, as it will subside on its own. B. Increase stimulation by engaging the patient in activities such as watching television or playing games. C. Maintain a calm and soothing environment, minimize noise, and engage in quiet activities to help the patient relax. D. Allow the patient to wander freely, assuming they will calm down on their own. Answer C. Maintain a calm and soothing environment, minimize noise, and engage in quiet activities to help the patient relax. Explanation: sundowning is a common occurrence in patients with Alzheimer's disease, and it can be managed by maintaining a calm environment and minimizing stimulation. Creating a quiet, soothing atmosphere helps the patient relax and reduces agitation. Engaging in quiet activities, such as listening to calming music or gentle conversation, can also help. Increasing stimulation, option B, or allowing the patient to wander unsupervised, option D, may exacerbate agitation and increase the risk of injury. Ignoring the behavior, option is not an effective strategy for managing sundowning. Question 21. Ms. Roberts, a 64-year-old woman, is living with rheumatoid arthritis and experiencing severe joint pain, particularly in her hands and knees. She is struggling with performing daily tasks such as dressing and cooking. How should the caregiver approach her physical assistance needs while promoting independence? I provide complete assistance with all daily activities to ensure she is not overwhelmed. B. Encourage Ms. Roberts to continue performing all tasks independently, even if it causes pain. C. Offer modified assistive devices, such as easy grip utensils and adaptive clothing, while helping her with more physically demanding tasks to maintain her independence. D. Suggest resting in bed most of the time to avoid further stress on her joints. Answer C. Offer modified assistive devices, such as easy grip utensils and adaptive clothing, while helping her with more physically demanding tasks to maintain her independence. Explanation: the goal is to maintain Ms. Roberts' independence while ensuring her comfort and safety. Using assistive devices for daily activities can reduce strain on her joints, while offering help with tasks that cause significant discomfort ensures she isn't overexerting herself. Completely assisting her option A, or encouraging her to perform all tasks independently, option B, may either undermine her independence or cause unnecessary pain. Suggesting bed rest, option D, could worsen her condition by reducing mobility and weakening muscles. Question 22. Mr. Collins, a 55-year-old man, has been diagnosed with diabetes and is struggling to adhere to his prescribed diet and medication regimen. He has been experiencing high blood sugar levels and frequent fatigue. What steps should the caregiver take to support Mr. Collins in managing his condition? I encourage Mr. Collins to skip meals occasionally to manage his blood sugar levels. B. Remind him of the importance of consistent medication intake and assist with meal planning that aligns with his dietary restrictions. C. Suggest that he stop taking his medication if he feels fatigued, as this could be a side effect. D. Encourage him to ignore his fatigue and continue with his regular eating habits to avoid disrupting his routine. Answer B. Remind him of the importance of consistent medication intake and assist with meal planning that aligns with his dietary restrictions. Explanation: managing diabetes effectively requires consistent medication, proper meal planning, and monitoring of blood sugar levels. The caregiver should help the patient stick to his prescribed diet and ensure he is taking his medication as directed. Skipping meals, option A, or stopping medication, option C, could worsen his condition. Ignoring fatigue, option D, might lead to further complications, as fatigue is a sign that blood sugar levels are not properly controlled. Question 23. A 70-year-old patient, Mrs. Johnson, has recently had hip replacement surgery and is now in the early stages of rehabilitation. She is feeling anxious and fearful about moving and walking again. What should the caregiver do to address her concerns and support her recovery? A. Discourage her from moving too much, as it could cause injury to the new hip. B. Assist with gradual, supervised movement and reassure her about the safety of her rehabilitation exercises. C. Focus solely on providing physical therapy and avoid addressing her emotional concerns. D. Advise her to stay in bed for as long as possible to ensure the hip heals properly. Answer B. Assist with gradual, supervised movement and reassure her about the safety of her rehabilitation exercises. Explanation: reassurance and emotional support are critical during rehabilitation. Gradually increasing movement, with assistance as needed, helps Mrs. Johnson regain confidence while promoting physical recovery. Encouraging movement is important after surgery to prevent complications, while avoiding movement, option A, or advising complete bed rest, option D, may hinder recovery. Physical therapy alone, without emotional support, option C, could make the process more difficult and anxiety-inducing for the patient. Question 24. Mr. Hernandez, a 55-year-old man, is being cared for after a stroke. He is experiencing difficulty with communication, particularly speaking and understanding language. What can the caregiver do to improve communication with Mr. Hernandez and support his recovery? A. Speak loudly and slowly, assuming he has hearing problems. B. Use nonverbal communication methods, such as gestures or writing, and be patient in allowing him time to respond. C. Avoid engaging in conversations with him to reduce his frustration. D. Force him to speak as much as possible to improve his language skills. Answer B. Use nonverbal communication methods, such as gestures or writing, and be patient in allowing him time to respond. Explanation. Stroke patients with language difficulties often benefit from nonverbal communication methods, such as gestures, writing, or using communication boards. Being patient and allowing time for the patient to respond is essential for effective communication. Speaking loudly, option A, may not address the underlying issue, while avoiding conversations, option C, can increase feelings of isolation. Forcing speech, option D, may cause frustration and hinder progress. Question 25. Mrs. Davis, a 68-year-old woman, has been diagnosed with early-stage dementia. She often forgets to take her medications and requires assistance with her daily routine. How should the caregiver approach this situation to ensure Mrs. Davis receives the proper care? A. Allow her to manage her medication independently, as it is important for her to maintain control over her routine. B. Set up a medication management system, such as a pill organizer, and offer reminders to help her stay on track with her medications. C. Focus on ensuring she follows her daily routine without offering any assistance. D. Discontinue her medication to prevent confusion and potential side effects. Answer B. Set up a medication management system, such as a pill organizer, and offer reminders to help her stay on track with her medications. Explanation. For patients with dementia, structured routines and reminders are essential to ensure they are taking medications properly. A pill organizer can help organize doses and provide visual cues, while gentle reminders can ensure the patient stays on track. Allowing the patient to manage medications independently, option A, may lead to missed doses, and discontinuing medications, option D, could worsen symptoms. Offering no assistance, option C, may lead to the patient forgetting critical tasks. Question 26. A 45-year-old man, Mr. Taylor, has recently been diagnosed with chronic pain due to a back injury. He is prescribed pain medication, but is concerned about the side effects and long-term use. How can the caregiver help Mr. Taylor manage his pain while addressing his concerns? A. Encourage him to stop taking the medication entirely and rely solely on alternative remedies. B. Help him explore pain management strategies, such as physical therapy, meditation, or other non-medication approaches, in addition to the prescribed medication. C. Advise him to take the medication as needed, without considering any alternative methods. D. Ignore his concerns about medication side effects, as the medication is essential for pain relief. Answer B. Help him explore pain management strategies, such as physical therapy, meditation, or other non-medication approaches, in addition to the prescribed medication. Explanation. A comprehensive approach to managing chronic pain includes not only medication, but also non-medication strategies such as physical therapy, relaxation techniques, and lifestyle changes. Helping Mr. Taylor explore these options can provide him with a holistic approach to pain management. Stopping medication completely, option A, or ignoring his concerns, option D, may not be helpful, and solely relying on medication without exploring alternatives, option C, can lead to dependence and missed opportunities for holistic care. Question 27. Ms. Allen, a 62-year-old woman, has recently been diagnosed with cancer and is undergoing chemotherapy. She is experiencing significant fatigue and nausea, making it difficult for her to eat and maintain energy levels. What should the caregiver do to support her during this challenging time? I encourage her to push through the fatigue and eat a large meal to regain strength. B. Help her maintain small, frequent meals and provide hydration options that are easy on her stomach. C. Ignore her fatigue, as it is a natural part of the process and she will feel better with time. D. Recommend that she stop chemotherapy if the side effects are too difficult to manage. Answer B. Help her maintain small, frequent meals and provide hydration options that are easy on her stomach. Explanation: fatigue and nausea are common side effects of chemotherapy, and maintaining adequate nutrition is critical for recovery. Small, frequent meals and easy-to-digest hydration options can help keep Ms. Allen nourished without overwhelming her stomach. Encouraging large meals, option A, may cause discomfort, while ignoring her fatigue, option C, could worsen her condition. Stopping chemotherapy, option D, is a drastic decision that should be made only by the oncologist. Question 28. Mr. Carter, a 75-year-old man, has been diagnosed with hypertension and is taking medication to manage his blood pressure. He has a history of forgetfulness and often misses doses of his medication. What should the caregiver do to ensure that Mr. Carter is taking his medication correctly? Set up a daily medication reminder system, such as alarms or a pill organizer, and monitor his medication intake regularly. B. Tell him to take the medication only when he remembers, without offering any further assistance. C. Administer his medication on his behalf, without discussing it with him. D. Advise him to stop taking the medication if he feels fine, even if it hasn't been taken consistently. Answer: set up a daily medication reminder system, such as alarms or a pill organizer, and monitor his medication intake regularly. Explanation: for patients with forgetfulness, setting up reminders and using pill organizers can help ensure that they take their medications as prescribed. Monitoring intake and providing gentle reminders helps ensure compliance with the medication regimen. Administering medication without discussion, option C, can undermine the patient's autonomy, while telling him to take medication only when he remembers, option B, may lead to inconsistent dosing. Discontinuing medication, option D, could result in unmanaged hypertension and increased health risks. Question 29. Mr. Brooks, a 63-year-old man, is recovering from knee surgery and has started physical therapy to regain mobility. He is becoming frustrated with his slow progress and is considering giving up on his therapy. How should the caregiver help Mr. Brooks stay motivated during his rehabilitation? Tell him that his frustration is normal, but encourage him to continue pushing through the pain, regardless of how he feels. B. Validate his feelings of frustration and set small, achievable goals together to track his progress over time. C. Allow him to stop therapy entirely if he feels discouraged, as forcing it may be counterproductive. D. Ignore his frustration and focus solely on making sure he follows the physical therapy routine. Answer: B. Validate his feelings of frustration and set small, achievable goals together to track his progress over time. Explanation: rehabilitation can be a slow and sometimes frustrating process, and it is essential to acknowledge a patient's emotions while encouraging them to persist. Setting small, realistic goals allows Mr. Brooks to see measurable progress, helping to keep him motivated. Encouraging him to push through pain regardless of how he feels, option A, may discourage him further, while allowing him to stop therapy, option C, could hinder his recovery. Ignoring his frustration, option D, may make him feel unsupported and less likely to continue with therapy. Question 30. Ms. Wang, A 79-year-old woman with mild cognitive impairment has started wandering outside her home, sometimes forgetting how to return. Her family is worried about her safety. What should the caregiver do to prevent her from getting lost while still respecting her independence? Install door alarms. Use a GPS tracking device and establish a safe routine to help her navigate familiar areas. B. Keep all doors locked at all times to ensure she does not leave the house unsupervised. C. Allow her to wander freely to maintain her independence, trusting that she will find her way back. D. Prevent her from going outside altogether, as it is too dangerous for someone with cognitive impairment. Answer: install door alarms. Use a GPS tracking device and establish a safe routine to help her navigate familiar areas. Explanation: for patients with cognitive impairment, it is important to balance safety and independence. Using door alarms and GPS tracking devices can provide safety measures while allowing Ms. Wang some freedom. Establishing a predictable routine can also reduce confusion. Locking all doors, option B, or preventing her from going outside, option D, may cause distress and reduce her quality of life. Allowing her to wander freely, option C, poses a serious safety risk.